Welcome to Pharmacy Friends, a podcast dedicated to bringing industry experts to the same virtual table to talk about what is happening in pharmacy today, what is coming in the future, and most importantly, what it means to you. Today's episode is brought to you by the MagellanRx Specialty Summit. The MRX Specialty Summit is back in New York City. Mark your calendars for August 29th through 31st and get ready to connect to better ideas, brilliant solutions, and the best industry thought leaders at the live event. Check out MagellanRx.com/specialty summit for more information. The MagellanRx team can't wait to connect with you in person. The field of oncology is rapidly changing and evolving. Treatment is becoming more precise, and the speed of innovation is compounding each year. Global oncology spending is expected to exceed $300 billion by 2026. As more targeted therapies come to market, more patients have the hope of living a longer life. In this past record-setting year, more novel cancer medicines became available for the first time than in any year in history, and many of them employ immunology or precision biomarkers to transform the way patients are treated. Adoption of breakthrough medicines and diagnostics is improving outcomes for millions around the world, though broad and equitable access remains a significant challenge to healthcare stakeholders, including patients. So how can the complexities of precision medicine be maximized to give cancer patients the best possible outcomes? With us today is Vice President of Clinical Strategy and Innovation from MagellanRx, Heta Makanji. Joining Heta is Clint Taylor, President of Trapelo, a company offering the first interoperable decision support platform used by oncologists, labs, and payers that informs testing and treatment, streamlines workflows, and facilitates real-time alignment in precision medicine. Let's get into it.
Hi, pharmacy friends. I'm Heta Makanji. In my role at MagellanRx, I develop clinical and specialty programs and strategies that help patients improve their healthcare journey. Today, I'm excited to be here with a special guest from Trapelo, Clint Taylor.
Hi, Heta. I'm Clint Taylor, President of Trapelo Health. Great to be with you.
Thanks, Clint. Very excited for you to join us. I'm really excited to jump right in and talk to you more about the role of precision medicine and oncology care. So Clint, tell us a little bit more about Trapelo's purpose and mission. And, we'd love to hear about your role at Trapelo as well.
Sure. Well, I've been in the oncology decision support space for, maybe a decade or so. And as part of that, I've had the opportunity to watch really the beginning of, maybe not the beginning of precision medicine, but certainly this last surge in the use of precision medicine. And as part of that, and working closely with oncologists and labs, I really became aware of the fact that this information is changing so quickly. There needs to be some kind of solution that makes it a little easier to create alignment in what does the evidence or what does the literature say is appropriate and how to use precision medicine. And so a few years ago, we developed a product called Trapelo, and we help oncologists basically know in a much faster way how to use precision medicine, what to test, when to test, who to test, and we create alignment with payers and with labs. So our whole goal and our purpose at Trapelo is to enable more patients to be able to receive the benefits of precision medicine.
So, we talk a lot about precision medicine and, there's several precision medicine areas, and, we're specifically talking about oncology. So would you be able to explain why precision medicine is important in oncology care and outcomes? And how do you think that a lot of the challenges and, opportunities, how do you think that will play into a lot of the oncology care and outcomes?
Well, some of the most exciting therapies for patients, those that are showing to be some of the most effective therapies, are precision medicine therapies. They're obviously informed by biomarkers that patients have that tell the doctor much more about the patient's disease. And then these therapies are designed specifically to address diseases that have these biomarkers. So it's why we think of it as being personalized, because they really are very personalized to your type of cancer. What that means, of course, is that patients who get these therapies are often likely to have a better outcome. The challenge, of course, is that these are expensive therapies, and so it's important that, from a payer perspective, they want to be sure that they're paying for something that's really appropriate. And it's kind of complicated because you don't always know exactly what to test for a patient to know whether a particular biomarker is relevant, or a set of biomarkers is relevant for a patient. And there are obviously there's a lot of considerations that go into that. The great thing about it, though, is that these are therapies that can save patients' lives, and that are saving patients' lives today. So that's really how I think it's most important, and really what makes it most rewarding for us in what we do today, is being a part of that.
Thanks, Clint. It's pretty exciting to definitely learn more about how precision medicine is going to impact, what drugs are being prescribed and how patients are going to be cared for. I think if we talk a little bit, obviously touching a little bit about the pandemic, but more so talking more about how precision medicine can help in getting oncology management back on track as we're coming out of the pandemic. I think it'd be really interesting for our audience to hear a little bit about what you think and how you think we can, the learnings that we get out of the pandemic for precision medicine specifically.
Well, we obviously all learned a lot during the pandemic, and one of the most saddening circumstances from the pandemic was certainly patients who didn't get proper care, because they were more concerned about COVID, and many people stopped getting screenings, and many people stopped getting care. And I can tell you personally, I had a neighbor who lives 5 doors down from me, who was diagnosed with cancer when the pandemic lockdown was happening. And he didn't go for treatment. He refused treatment because he didn't want to be in a hospital alone. He didn't want to die alone. And a couple of months later, he passed away. I don't know what would have happened to him. But when you ask about, and I don't know what would have happened to him if he'd gotten the proper treatment, but my guess is that his outcome would have been much better.
Mm-hmm.
That's one example taken to the extreme. But now you have millions of patients who aren't going for screenings or not going in for their follow-up appointments. So I think if there's anything that we have to learn to take away from the pandemic, is that we have to be much more thoughtful in how we encourage patients to continue in their course of treatment. Cancer did not stop with the COVID pandemic like everything else did. It just marched straight ahead. And I think that I'm hoping that we've learned something from that, so that we can help patients stay up with that. It's hugely important, and we know this as being in this business. We know that time is critical, and whether it's in the length of time it takes to get a test result back, or whether it's the time that you spend between therapies, time is a huge factor in cancer treatment.
Yeah, no, you're absolutely right. Time doesn't stop in that space as well. So, that's a really good perspective, and creating awareness is going to be super important as well. Pivoting a little bit in talking around precision medicine and how it plays an important role for key stakeholders. When we think about precision medicine, we know it impacts members, providers, labs, payers, and I'd love to hear your perspective on how much of an important role this plays for members first.
I think we all know that precision medicine offers the best hope for the best outcome for so many patients, and that number of patients is growing. So it's really important for patients to have the opportunity to be, considered for these new therapies. Um, I know that, I've told this story many times, but when I first became the CEO of Trapello and we were looking at how we could really use this technology to make a difference, we were thinking about the various stakeholders, providers, payers, labs, and thinking where should we be selling this? And I was driving back and forth to Tulsa. My dad was battling cancer at the time, um, and I found myself really, thinking about this problem. And of course, it was a business problem. Where do we sell our product to? And I realized that this problem we can't get uh, precision medicine to members without the participation of providers, labs, and payers. And I realized that that was going to be a big problem. But um, but I decided at the time that that was what we were going to do. We were going to make it. We were going to make this a product that really serves the ecosystem, and we were going to look for ways to create um, alignment because members need this opportunity. And as I was really then beginning to pour myself into what's keeping members from having access to testing and ultimately to be a candidate for some of these treatments and therapies, I realized that this is a much, much bigger and much more complex problem. It's not just a matter of a member who might even have the benefit of knowing that they want to be tested. It's even then not easy for them to have access all the time. And this was an even bigger problem in 2017 when we first started to solve this. But members is the heart. Members or I should say patients who are members are really at the heart of what's driving what we're doing.
Thanks, Clint. I think that really puts a good perspective on how this is going to be really important for patients and members specifically. When we think about cancer care and obviously value-based care with precision medicine and the real-time decision support that Trapello is offering for oncologists, where do you see the biggest opportunity for providers and payers to keep up with the number of new indications for certain drugs and the fact that the accelerated approvals for drugs as well? How do you think that precision medicine, the tool that you guys are providing, is going to help providers and payers keep up with the increasing new indications, the increasing number of drugs, and even changes in guidelines?
Yeah, well, that's a really important question because it starts with the premise that is I think widely understood and agreed on now, which is that this is super complicated and it's changing really quickly. So anytime you have information that's changing quickly, it doesn't matter how really well connected you are, it's a great deal of effort just to keep up. So if you're an oncologist and you specialize in one type of lung cancer at a large institution, much easier for you to keep up. You still have to work and be very, very diligent to do that. But if you're an oncologist in the community and you're seeing multiple types of patients all the time, then it's really an enormous and really impossible challenge to keep up with all of those changes. And sometimes I help people understand that by saying that, we have a team of PhD scientists and their staff who's, along with technology, that the technology looks at all of the sources for which new information gets published, and our technology then looks at that and sorts it and basically distributes that to our PhD scientists to then review it and help kind of ascertain what is relevant and needs to be added into our database, our knowledge base, that is then used as the foundation for our decision support platform. And when I think about, which I do often, all of the complexities that have to go in from our side just to make those kinds of changes and keep up with it, that is a combination of technology and scientists, I think, wow, that's what we're doing to make it possible for doctors and for payers to stay aligned on what should be done, who should be tested. How do I understand these particular results? What new therapies are now relevant and informed perhaps by biomarkers that perhaps weren't really relevant just a year or two ago? We did this recently. We just did a quick calculation. I think in the first half of the year of 2021, we made about 200 changes to the database that were relevant to guidelines. That's a lot. We were making other changes to the database that informed decisions, but guideline related changes, you can imagine doctors trying to keep up with that. And that number is accelerating because new research is coming out all the time. So it's really important. And this is a great application for technology. Anytime we need to sift through and sort through a lot of information quickly, technology is great for that. We're not taking the decisions away from doctors. We're simply empowering doctors to make decisions faster and to look through more information and to access this in a way that is timely.
You know, the biggest thing that you mentioned there was the fact that that there were 200 updates, or 200 guideline updates, and the fact that that's, a lot of that is related to precision medicine, biomarker testing, and then there's the entire drug piece of it too.
Yes.
Which is incredible as to how accelerated it really is. And for providers, you guys are making it easy, right? And decreasing the burden. If we think about prior authorization, right? So let's touch on that a little bit. I think you guys offer a lot of value in that area around decreasing burden for providers. So, if we could talk a little bit about, how you guys are impacting prior authorization and decreasing burden for providers, I think that would be really helpful.
Sure. So my background is in prior authorization services and oncology. And so dating back to maybe 2008, when I started in that space, I've always been in healthcare technology, and I was doing different types of things, but I got really focused in oncology in 2008. And so I became very familiar with some of the challenges that both payers and oncologists face in trying to come to some alignment on what's appropriate, what's appropriate for treatment. And as we moved into the age of precision medicine and testing became more of a challenge, I actually had the opportunity to work with a team who was rolling out a new molecular test. And I was talking to doctors all over the country. And the biggest challenge was always, look, this might be a great test, but I don't know when to order it. I don't know exactly what patients might benefit from it. And the payer that I'm working with on behalf of this patient has a set of policies that I don't even think align with this at all. And what I learned in that process really was that most payers, and I think most payers would agree with this, most payers look at testing and therapy decision support as two different groups. They usually have a genetics team who's kind of looking at kind of all genetic questions, genetic testing. That includes somatic and germline testing. And then they usually have a kind of a drug therapy team, PA team, and maybe two of those who are looking at what therapies are really appropriate and what should be reimbursed. And what I noticed is there's a disconnect. It's very difficult to keep up with and to keep those aligned because they're looking at different resource support groups sometimes. And what we decided to do with Trapelo is tie those together, base them on the same database. And we start with the therapy and work toward the test. In other words, what therapies are available, what biomarkers inform the use of those therapies, and then what tests contain the biomarkers and can be offered in the most efficient way. By doing this, we can give a payer, and hence a provider and a member, the confidence in knowing that when this particular payer is looking very holistically across the board, and they're tied together. So we don't have a situation where a payer denies a particular test that contains a biomarker that would inform a therapy that that same payer would be willing to reimburse. And we saw this happening, and we still see it happening over and over and over again. And that's a disconnect that should never happen. So I think that shift, that paradigm shift, is really important in the precision medicine age, because if you're not looking at it from that perspective, where the same knowledge base is driving and informing both therapy and testing, then you're going to have these disconnects. And that can be very detrimental to patients and super frustrating to providers who are saying, you're denying this test, but it informs the therapy that you'd be willing to reimburse. This is not, it shouldn't be this way.
Thanks, Clint. You know, it's when you think about, you know, how far everything has come along, and even our partnership and the exciting things that we have coming in the future, you know, with the number of years that you have been doing this and the impact you've been, you know, able to make, can you speak to some of the examples or the results as it relates to precision medicine, whether it's from an outcomes perspective, what you've been seeing from providers, and you know, and changes in their behavior as they're adopting to a lot of the you know, the work that you guys are doing with Trapelo and utilizing the tool that you guys have?
Sure. One of the things that over the past few years that I've come to really believe is that um, following evidence-based guidelines is broadly leads to better care. And I understand that there are times when patients kind of outlive guidelines, and there are no guidelines that really lead a really logical next step or course of treatment for someone. I get that. But by and large, when we follow the literature and the research that's been published, it leads to better outcomes, and often even usually lower costs. And I think there are independent third-party studies that have borne that out. So we really focus in on how do we do that? How do we make that possible? And as I mentioned earlier, it's impossible to follow guidelines for therapies if you don't follow guidelines for testing. If we don't make sure that we're testing the right patients for the right biomarkers. And there's been some really important research that was done, studies that were done, surveys that show kind of the lag in adoption of biomarker testing as new biomarkers become relevant for certain therapies. One of the things we've noticed that and been able to track is that we are able to collapse that time it takes in the adoption of biomarkers. Let me give you an example. So we might see that a new biomarker comes out and it informs a brand new therapy. We might see that it takes several years for that biomarker to be widely adopted in the community. And what I mean by that is that certainly if someone is ordering large panel tests that include that biomarker, yeah, they're getting tested, but that's not always appropriate. According to some payers, they may not want to pay for or reimburse for that, and sometimes patients aren't getting it because there's pushback. All of those are factors that lead to slower adoption in testing of certain biomarkers. But what we found is that when we put Trapelo in place and oncologists begin to use it, we actually collapse that down to virtually immediately. In other words, a doctor who's using Trapelo to help make a testing decision finds that that biomarker is now one of those that is suggested for a particular patient. And the next step shows them the labs and the tests specifically that include that biomarker. And then we go back and look at it and we can say, well, while it might have been adopted 50% of the time kind of broadly and in general, we might immediately spike that to 97% or 94% of the time.
Wow.
That's a massive shift. And what that does for everyone in the ecosystem is that it allows payers to say, look, because I can be sure that patients were tested for the right biomarkers, and because Trapelo was suggesting the testing that as a payer we would find appropriate that is value-based. Maybe it's not a huge panel, but it is a panel to include all of the necessary biomarkers. The payer's now satisfied that they're paying for quality. Patients can be sure that the testing that's being done for them is appropriate for their cancer, this stage, include specifically their condition right now. And doctors can have a more expedited experience, knowing that I'm not going to send this to the lab, wait for the lab to come back and tell me that they either did or didn't do it, that they either did or didn't get, they're waiting for a prior authorization. This can streamline that process. We can take time out of the system, because where they might wait for the lab to get a prior auth, sometimes that's the case. They can be confident knowing that they selected a test that is concordance with guidelines, includes all the biomarkers that should be tested, and can bypass some of the delays that can otherwise happen in getting a prior auth. So we think we're making a huge difference for patients, for doctors, for labs. Labs don't want to have to take extra effort to get a prior auth. And frankly, payers don't always want to have the additional cost to do that as well. They want to know that I'm paying for value, I'm paying for appropriate testing. And when we can create that alignment in real time and do it in a matter of seconds or minutes, that can make a big difference in the whole patient journey. And by the way, one more thing, and I think this probably doesn't even need to be stated, but if we can take a few days out of the process for turnaround time on labs, we give that patient a better chance for that doctor to wait for that result to make a decision. And we know today that sometimes patients and doctors, they move forward with a therapy before waiting for that result. And that can sometimes lead to a therapy that's perhaps less efficacious for the patient than one that might have been informed through the results of the testing.
Thanks, Clint. That's pretty incredible. Just the adoption rate that you mentioned. And, I really loved how you summarized what type of impact it really could have on members at the end if providers are able to really get the results as quick as possible and be able to prescribe the medications. It's all really incredible. And, if we think about the future of precision medicine, right, and we know that it's going to be a large amount of drugs that are going to be impacted by biomarker testing and just the costs associated with precision medicine. Where do you see the future evolving? How do you see it evolving with precision medicine and with targeted therapies in oncology? And to end, I guess, how much of an impact will Trapelo make with, especially with the future? I know we touched on guideline updates and things like that, but how else do you think it will be evolving?
It's all going to be computerized in a way where it happens in real time, like we're talking about. We already know that there's waste, there's delays, there's friction, there's discomfort in the system. Now I know some of that is, some would argue that some of that is kind of built in through perverse incentives. And I get that. But this is going to become more and more complex. It is going to become completely dependent on technologies that create these alignments in real time. And anytime you have multiple factors like we have here, where we have literature that informs whether a therapy is appropriate based on a biomarker, and new information that informs whether that biomarker is relevant. And then you have policy guidelines that vary across payers, and you have all these different factors that need to be considered. It's already impossible for an oncologist to keep up with that, which is why practices practices, payers, and labs are all struggling with it. So the future of this is going to be systems like Trapelo, where it's managed in a single instance in real time. But because we just rolled this out recently, where we were able to demonstrate between payers and providers that we can create this alignment, we're going to be I think, leading in this. I'm not saying that we're always going to be the only one who's kind of trying to pull these together and make this happen in real time. Others are already and are going to continue to do it. But the future is going to be a system, and that's the easiest way to describe it, a technology where oncologists go to first before they think about even how they're going to treat a patient. And they're going to think, all right, what do I need to test? I need to go into a particular system that's going to inform me on that. And when the results come back, what can I do with these results? And more importantly, and this is where we're going, we're heading to a place where, alongside of the results that come back in a dynamic, real-time, call it a portal, but it's a view, rather than looking at a PDF today, as most doctors do, they're going to see it in an actionable fashion where they're going to see the results. They're going to see statistics alongside of each treatment option that show them, according to clinical literature, these are treatment options that are appropriate. And they're going to look into databases, both of their own and across national databases, that say, what are outcomes data that can inform me as well? How has that outcomes data compared with the clinical literature? And they're going to be able to connect instantly with not instantly, but they're going to be able to set up tumor board reviews with oncologists that are across the country who can weigh in on it. And this is all enabled through technologies that we have today, but those technologies are just now coming together. And we're going to see, as we do more and more testing, we're going to have more and more patients who live beyond the literature, and we're going to rely more heavily on what other outcomes data could we look to that might help us inform what to do next for patients. And I get super excited about that vision. I want to be a part of that, because I think that technology is going to enable more patients to get the right therapies. It's going to take waste out of the system. It's going to collapse the time it takes for patients to get on the right therapies. It's going to give us a more holistic view of patient journeys, where we have a chance to see this. And the exciting thing that we're doing with Magellan, of course, is that if you look at Trapelo, we only solve the precision medicine piece of it. But by partnering with Magellan, we are now able to say, Magellan can now look and say, what did the patient's journey look like before getting to a stage where precision medicine was appropriate? And as we treated that patient over a course of time for that patient, and then they went into now using, let's just say, liquid biopsies or blood-enabled ways of monitoring that patient as we go on, and what are the outcomes and what were the cost of those treatments. Magellan is so beautifully and uniquely positioned through Trapelo to be able to look at those patient journeys in ways we've never been able to before, and then let that information inform future patients. To me, that's the future. That's where we use data really, really effectively. That's how we begin to inform treatment and therapy decisions in ways that we don't do effectively today. And if we do, it's very manual. It's very labor intensive. It happens only in major academic institutions where they have some resources. They see fewer patients. They can really dig in. We're going to be able to, through technology, enable this in ways that community oncologists were never able to do this before. And that, to me, is really exciting. And to me, that's the future.
Clint, super exciting. I'm very excited about, our partnership and even the future of impacting, especially patients. Everything is really exciting as far as, oncology and cancer care and precision medicine. I want to thank you so much for joining me today. I'm really excited for people to hear more about precision medicine and learn from our conversation. And thank you so much.
You bet. Thank you for having me. It's great to be working with you guys.
What a great conversation between Heta and Clint on the role and evolution of precision medicine in oncology care. Until we chat again, make sure to subscribe and rate this podcast 5 stars. We'll talk soon.